quest to find innovative surgical techniques has led to many great advances. Today, there are an increasing number of these options becoming available to more people. I'm Larry King, and today we're bringing the latest in medical technologies in view.
The quantum leap in medical technology is providing healthcare providers the ability to deliver cutting-edge quality care never seen before, especially in the community oncology setting.
Community oncology is a field where we are providing very complex care to patients in a very intimate, neighborly environment. Essential to that experience is to ensure that we improve communication and also improve sharing information. Those two ideas are what drive a lot of the technology solutions that we're talking about here today.
Enhanced communication and technology advance the quality of patient care, especially for patients with complex diseases such as cancer. Physicians and their staff can use technology to improve practice operations and clinical efficiency, and to better communicate with and care for their patients. Patients can use technology to play a more active role in their health care and feel more connected to their care team.
So the first technology I would recommend is a Zynomed. It's an EHR, and that stands for electronic health record. And what essentially it is it takes patient information and stores it and makes it accessible to physicians.
Zynomed, which is our preferred electronic medical record, really does a wonderful job of displaying data, organizing it, so that when I see the patient, I have a clear picture in my mind of what's happened, where are we going from here, and what do we need to focus on that day.
Well, there's a lot of functionality that's in the next generation version of Zynomed. The speed, the ability to quickly access a patient's chart, navigation.
It's important to always keep track of how much of the drug you're giving. The nice thing about Zynomed is that it actually blocks you from even giving the drug until you've populated with how much drug has been given. It doesn't just retrieve information that's inside the system, it also even asks you, has this patient received adriamycin at the hospital or in other institutions, and does that information, does that data need to be integrated into the overall calculation of how much drug a patient has had? Those type of clinical pathways that are feeding the back end of the system is really what I think separates this system from other EMRs, and it allows me as a physician to be comfortable knowing that I'm equipped with the appropriate information and that there's also a safety net in place to make sure that I do things as appropriately as I can.
Zynomed, as part of its feature, requires that the doctor enter all the data regarding the specifics of the patient's tumor. So all of that information is incorporated into Zynomed, and then Zynomed can actually use that to say, okay, this patient would be a candidate for these studies, and allow us to look at possible matching up a patient with an appropriate study based on the stage and cell type of their cancer.
By creating customized and flexible technologies specifically for the specialist physicians, their staff, and the patients they care for, emerging technologies are helping to advance the delivery of care.
iCare Plus is a web-based application that allows patients to look up information about themselves. And when you have cancer, it's a very serious disease and you want information. So this gives you a one-stop shop to go in and look up information about your care, your treatment, maybe some labs that were given to you, your insurance, and patient education about your disease, so you can find out all you need.
Our patients have been very enthusiastic about accessing the patient portal, which is the easiest way for them to track their data along with us, and it helps the trust relationship between us.
So CMD is a tool that we developed on our own, which is being used currently as a beta in our practice, and basically it's a mobile application that allows for HIPAA-compliant communication between physicians and patients, and also physicians and other physicians, and ultimately improves not only the communication between physicians and patients, but also the sharing of information.
I think that I like the idea that I can log in and look at my lab results, look at my, radiology results, look at all that information and have it at my fingertips. I like that a lot.
To learn more about these exciting technologies, visit Maryland Oncology Hematology online at www.mdonc.com or the U.S. Oncology Network at www.usoncology.com.